Next, I'd like to welcome Josephine McGuiness. Josephine is originally from the UK and has over 20 years' experience working as a clinical pharmacist both in the UK and Australia. Josephine has held a number of increasingly senior and diverse clinical and education roles over 20 years at Alfred Health, including emergency medicine and medication safety. And she's also worked in GP practice and at RMIT University. Before she was appointed to the director of the Coroners Prevention Unit at the Coroners Court of Victoria a year ago, she worked at the Department of Health in the Incident Response Team at Safer Care Victoria, where she was the manager of Patient Safety Review Team. She has also led the team responsible for acute care at their centres of clinical excellence. During her time at Safer Care Victoria, Josephine coordinated a number of statewide safety system reviews, including into the Austin surgical washer incident and clinical incidents that occurred in hotel quarantine. Her team was responsible for ensuring learnings translate into safer healthcare across the sector. She was also a team lead in the COVID-19 case and contract tracing team, and Josephine has a Master's of Clinical Pharmacy and is undertaking an Executive Master in Business Administration at QUT University. Josephine has sought out her current role at the court because the work aligns with her values about making a difference in the community and her passion for improving safety. So if you can all please put your hands together and welcome Josephine McGuiness. Thank you.
Okay, so lucky last for the day. Hopefully it will put a positive spin on something that people are always deal with a little bit of intrepidation with, which is coronial investigations. What I'm going to just walk you through is some more of the general principles as well of coronial investigations. We hope that doesn't touch any of us, but if you do, it's always good to have that familiarity. So the Coroner's Court is a specialist inquisitorial court, so it's quite different from other courts that you may ever need to interact with. The purpose of which is to make actual specific coronial findings and to contribute to reduction in preventable deaths. So what is the role of the coroner? In Victoria at the moment, we've currently got 14 sitting coroners, and their aim is really to contribute to the reduction in the number of preventable deaths. Really importantly, it's not for a coroner to determine guilt or apportion blame. That's something that when you're engaging with the coronial process is really important to understand. And the aim of the investigation is to ascertain whether there were adequate systems in place at the time of the death. Investigating deaths is in relation to the Coroners Act 2008, and the coroner has three key roles that they need to fulfil during their investigation. One is to establish the identity of the deceased, one is to establish the cause of death and the circumstances that were proximal to their death. So there are many reasons why a death could be reported to the Coroner's Court, but the two highlighted here are mainly the ones that you would potentially see in relation to drowning. It would be an unexpected death or a death caused by accident or injury. Reviewable deaths in Victoria as well are in Section 5 of the Act, any that involve a deceased child or a subsequent or second child of the same parent is deceased. So this is just a bit of a snapshot which might put some context to why coronial investigations take as long as they do. The numbers didn't change very much from last year, but there's approximately 7,500, I think, last year, new investigations opened at the court, and there's about 25 reportable deaths every day in Victoria that the coroner on duty that day has to deal with. A vast majority of those end up being natural cause deaths, but around 34-35% are due to accidents. On average, we're always trying to get it quicker, particularly to not prolong how long families are involved in the coronial process. But it takes, on average, 7 months to investigate a death, and there are a number of reasons for that. In the year 2019-2020, the coroners made 166 recommendations, the majority of which were accepted, and some are also awaiting response, and I'll walk through that a little bit later on. So the role of the Coroners Prevention Unit at the Coroner's Court. So the Coroners Prevention Unit is actually a specialised service for coroners, and it was created in 2008 to strengthen their prevention role and to provide coroners with expert assistance and informed opinions in their death investigations. CPU staff include clinicians, public health practitioners and data specialists whom coroners can engage to assist at any point during their investigations. The unit consists of 5 multidisciplinary teams with expertise in several areas. So we've got health and medical, mental health and disability, family violence, research and data, which includes suicide and general investigations such as drownings. And we've also got a knowledge management and project team. So the CPU teams provide evidence-based advice to assist them with the prevention-focused aspects of their investigations and the research and data analysis to support their broader prevention-focused work, which also includes responding to requests and data from coroners, external agencies, and the media. The current resourcing is sitting at 22 EFT. We've got a headcount of 31. And over the past 5 years, there have been about 650 coronial referrals to the unit, which is on average about 55 per month. Requests from external agencies for data and assistance have also been relatively steady at around 40 requests per year. Coroners can refer a matter to the unit at any stage during their investigative process, and the request, it can really vary substantially from case to case. At the initial stages of a coronial investigation, typical CPU assistance might involve advising on the direction of the investigation, ensuring that essential information is gathered, and identifying potential underlying prevention issues. As the investigation progresses, CPU staff might be asked to review evidence, provide advice on the circumstances in which the death occurred, assess the appropriateness of care that may have been delivered or sometimes not delivered, particularly in healthcare cases, to the deceased, and identify and engage experts to provide opinions on particularly complex issues. We also review the legislation and the codes of practice applicable to the death. The coroner might also ask the CPU to provide data about deaths to assist in determining whether there might be bigger underlying systemic issues that need to be addressed to prevent future similar deaths from occurring. For this purpose, the CPU maintains a central database of basic information about all deaths reported to the court, as well as specialist databases that contain more detail about certain types of preventable deaths. These include suicides, homicides, and overdose deaths. When coroners are finalising their investigations, the CPU can also assist in providing advice on prevention opportunities emerging from the investigation, reviewing what academic and public health literature says about the issues being examined, and consulting with stakeholders who might be affected by a recommendation, and identifying relevant recommendations that show how coroners have approached the issues being investigated. The CPU's ultimate aim is to improve the quality and applicability of coronial recommendations and increase the rate at which they are accepted and implemented. The CPU ultimately hopes that through this process it will contribute to the vital work of the coroners in Victoria. I'll just quickly go through the teams. I won't spend too much time, but just so you get an idea of who's involved. So with the health and medical team, we've actually got a number of consultants that are working currently at hospitals and facilities across Victoria, and they assist with advice regarding the medical treatment provided to the deceased. An example case that they may be involved with is assessing adequacy of for example, preparation for surgery, including whether potential complications were identified and whether it's more appropriate for the surgery to be conducted under a general, for example, versus a local anaesthetic. And they'll also assess the adequacy of the care for a patient, for example, who presented to an emergency department. Our mental health and disability team have clinical backgrounds as well. We have a number of psychologists working with us at the moment, and they've also got those with experience in the disability sector. They assist with advice regarding mental health treatment and services being provided to the deceased. We also have a very strong and increasing focus on family violence. We have a number of practitioners who have detailed knowledge of the family violence services in Victoria, and also responding to the Royal Commission into family violence as well. One of the key things, particularly about the family violence team, is we have, to let people know, there's a group of family liaison officers where once a death is referred to the court, they work very closely with the families to make sure that at this a critical time that they are aware of what is going on in an investigation as well. The research and data and general investigations team, this is the team that if you are ever involved with the CPU that you probably have the most contact with. They maintain a range of databases, including the Victorian Suicide Register, Homicide Register and Overdose Deaths Register. They really assist with a broad spectrum of death investigations, which include motor vehicle fatalities, drownings, falling from ladders, things like that. And they will do a lot of work with the media team as well. Finally, we've got a knowledge management and projects team, which is really helping us transform, particularly pivoting during COVID, to being able to work remotely as well and propagate the knowledge that we do have. So in terms of coronial data, people always want to know what we can share. An important point, I think, leading on from what Bernadette was saying, that you can ask, but the majority of the time no comment will be made on a case while it's going through an active coronial investigation. And that is because the investigation really does need to take its course, and as we get statements in from individuals that were involved in the incident, the information and the trajectory can change. If, however, someone is wanting to be an interested party and get information on a particular case, an application can be made to the court for coronial documents using what's called a Form 45 on our website. Any release of or publication of coronial information held that isn't otherwise publicly available needs to be approved by the data custodian, which is actually our state coroner, who is currently Judge Kane. Data with a prevention focus, however, we're very much wanting to share, and it can be in a de-identified manner. And I'll just walk through our relationship with Lifesaving Victoria, an example of how that occurs. Findings and recommendations in the majority of cases, once a coronial investigation is finalised, are made publicly available as well. So recommendations and responses. A coroner can make recommendations on any matters in relation to a death or a fire, and that includes a fire as well, where they do investigate fires, but there are also no fatalities. Recommendations can be made to pretty much anyone. That can include ministers or public statutory authorities or entities. And once a recommendation is served by a coroner, a written response to that is required. That's very important. And it needs to specify the actions that will be taken in response to that recommendation. And that needs to strictly occur within 3 months, or there is a bit of a public naming and shaming because it is published on the internet if there is not a response. So it's really, really important, even if you're not able to engage with the recommendation, that you front foot and let us know early. So in terms of formulating coronial recommendations, coroners are aiming to find those systemic problems and look for potential solutions and improvements. What they're trying to do all the time, and if you ever have to engage in this process, please remember they are trying to improve the safety for all Victorians and get some changes to existing practice if they need to occur. That includes policy reforms, and we really want to feed into research as well for a better understanding of the nature of adverse events that occur. These recommendations are not formulated in isolation, and there's a really strong reliance, and it usually feeds through our unit, of getting expertise from the people that work on the front line and the relevant organisations, and particularly in this case Lifesaving Victoria, for sense checking those recommendations ideally before they're handed down. We have a close working relationship with Lifesaving Victoria. We've also got a bit of a bespoke data sharing arrangement as well. So in terms of coronial interest into drowning prevention, since 2000, Victorian coroners have made 238 relevant comments or recommendations that were associated with 104 individual findings in relation to unintended drowning deaths. So here are just some examples of how the coronial process and these recommendations have translated to change within the industry. So starting into this is just a sample, by the way. far from exhaustive, but in 2008, a young child climbed over a pool fence and drowned in a backyard swimming pool. And the Deputy State Coroner at the time, Coroner West, established through his investigation that the pool fence did not comply with the relevant Australian standards. He made several recommendations as a result of that to building regulations, to private swimming pool inspection arrangements, and for fencing in rental properties. In 2010, a young child sadly drowned at a bayside beach, and Deputy State Coroner English examined the ability to swim programs for young children and adopted an earlier recommendation that had been made from Lifesaving Victoria that swimming and water safety education should be made compulsory for those as part of the Victorian primary school curriculum. And I'm very happy about that because my 6-year-old is actually going through that very training next week. In 2014, a young adult international student drowned at an ocean beach, and Her Honour Coroner Spanos commented on the drowning risk of those born overseas and endorsed an earlier recommendation that international students should be particularly targeted with respect to water safety education. And a final example, in 2014, a young adult also drowned at a public swimming pool in Victoria, and Her Honour Coroner Jameson made specific recommendations a number of specific recommendations to the operator of that particular pool, but more broadly a general recommendation to the Department of Premier and Cabinet about oversight and regulation of public swimming pool operation in Victoria. So as I say, we've got a strong working relationship with Lifesaving Victoria. We have a memorandum of understanding between the two agencies that's been around since approximately 2015. We actually provide on a weekly basis a spreadsheet of alerts to Lifesaving Victoria on every potential unintentional drowning death. This data is derived from when the police are first on scene. They complete what's called a Form 83, so that's how we establish if there's potential. This could have been met the criteria for an unintentional drowning. The data that we do share is identifiable, but through this memorandum of understanding, it is kept confidential and secure, and it's there particularly for data matching purposes. So we make sure that all of the unintentional drowning deaths are being collected and captured. The seasonal variation, just to give you a flavour of the numbers we're talking about, can vary from anything from 0 in a week up to 8 drownings in Victoria in a single week. Coroners also very much leverage and appreciate the feedback from the experts at Lifesaving Victoria on potential recommendations they're considering. Expertise and insights from the industry on drowning-related issues. It's also really important to understand from the industry and those working on the front line where the pressure points are and where there are those potential opportunities for fatal incidents to occur. And they may also have specific questions that they would like feedback on in relation to a case they're investigating. Just to finish up, in terms of future direction or where the coroners are at the moment, one of the current issues under consideration is the safety of residential Class 3 aquatic facilities, so the pools in places such as hotels as well. They're currently actively investigating two recent deaths which have raised potential concerns in that space.